My name is Alison and I work as a dietitian with the Department of Health in Tasmania. Our approach to preventative health aims to be positive and non-shaming, and we are mindful of our own privilege. We know everyone has varying degrees of choice in the decisions they make around their health. And we know not everyone has equal access to healthcare, education, employment, food choices, livable communities, nor do we have the same genetics. Consider this for a moment. Most of us work in health because we want to help people be healthier. What if it was possible to work in a more compassionate and potentially less stigmatizing way to improve health? What does this look like in a practical way? Today, I'm going to share with you one example of this from our work with the Healthy Kids website and related social media. Bringing a child into this world is both a privilege and a responsibility. Time and time again, when we work with parents and community, what comes through is that all parents, no matter what their circumstances, instinctively want to give the child the best start in life. And we know parents have a strong influence over their child's diet quality, eating style, and body image through early feeding practices. And this impacts on the child's growth and development and their short and long-term health and well-being. Research has shown that about 70% of millennial parents value the insights and advice that they receive from parenting websites and blogs and social networks. So how do we play in this space? We know we want to build parents' resilience and skills to parent in a healthy way, even when they face potential barriers such as their own food history, food insecurity, diet culture, and the environment in which we live, which doesn't always make healthy choices easy choices. So our content includes information on body diversity and body confidence for both parents and children. Feeding and nutrition advice. We align ourselves with the Alan Satter Division of Responsibility model of feeding. And we acknowledge there's a normal spectrum of feeding children, and we try and provide practical, affordable food ideas for families. We provide physical activity advice, but we talk about it in terms of movement, active play, and managing screen time. And we touch on mental health topics for children and parents, for example, self-care, anxiety, body image, all the things that affect how we parent. And often working through this is key to doing better in their own parenting. We aim to empower parents to make positive health behaviours for themselves and their children and to model body positive parenting. Our content includes video, images, snappy quotes, and blogs, and they're all designed to be short and to the point to grab the attention in a busy media space. The advantage of using social media and websites is that you do have the Google Analytics and Facebook Insights, which show you who you're reaching, when and what people like, which is really useful. And through sharing, we've been able to reach a lot of people. And this actually supports a wider community conversation around parenting and food nutrition that's evidence informed. I'm just going to share with you a few tips about using social media from our experience. We've been really careful about choosing our words. We're trying to avoid use of diet culture language, weight stigmatizing language and tone. And if you need help, seek some help to get training around this. It's really, really important. Be real and authentic. Don't give impossible food ideas. We try to acknowledge what's real. For example, fruit does come home uneaten in the lunchbox, and there are kids that like tomato sauce and everything. If the advice resonates with people, they have more of a chance of listening to it. In social media, you engage with your followers. Actually listening and learning from them helps you develop content that people want. And don't be afraid to use humour or show compassion, because we know parenting is really hard at times. It's been really important for us to be consistent with our approach, which means we're careful about what we post and what we share from others. And for us as a government service, it's also been really important to have a documented and approved social media strategy. It can be challenging to step outside the construct in which we're living, where body weight is placed front and centre of the child health equation at times. But we'd also be naive to think that the public discourse around obesity and weight does not impact children in a negative way. The rise in eating disorders and prevalence and the pursuit of the thin ideal in the increasingly younger children is of concern. And with our approach, we try to support families to have meaningful health and wellbeing conversations without stigma or shame.